Hi, I'm Joyce with Go Your Green Family. Thanks for joining us. We're going to be exploring women's health topics today with Molly McKenna of McKenna Physical Therapy for Women.
Hi.
Hi. So what we're doing here is exploring our local resources and wellness experts and enjoying their expertise and letting you get to know them a little bit more as they educate you on what you can do for your health. So today we're going to be talking about physical therapy for women with Molly. And I just have a variety of different questions that we're going to cover. So Molly, what I'd like to start us off with today is how would a woman know if she's having, well, before we get to that actually, what is the pelvic floor?
So the pelvic floor is generally people refer to the pelvic floor as the levator ani muscle that spans from the pubic bone in the front of the pelvis to the tailbone in the back. But it also incorporates the ligaments, nerves, bony structures, and all of that's involved with supporting your pelvic organs and the pelvis itself. But a lot of times people call the pelvic floor, they're referring to the muscle component of that.
So it's kind of a web of muscles and ligaments that basically hold all your body parts and your organs up in your abdominal cavity. Is that kind of
correct?
The layman's terms?
Yeah.
Okay. So men and women both have pelvic floors.
They do. Yep.
I think that's an important point to make. Guys, this is not all about women. We just tend to struggle with more issues with it because of our structure is a little different, but pelvic floor is definitely important for the health of both men and women. So we know what the pelvic floor is. So how would a woman know if she's having pelvic floor issues?
So they can have a variety of issues from incontinence, urinary leakage, to pain or like a pressure or heaviness sensation in the perineal area, that outer aspect of our vaginas. But those are the main ones. So incontinence, pressure, or pain.
Okay. And some women, this happens, a lot of women, it comes on after childbirth.
Yeah, frequently after childbirth we'll see it, or during pregnancy. Sometimes it'll start actually during that time.
Okay.
It's not limited to people who have had children. So sometimes if you've had like repetitive strain in your life, like you had a job or did heavy lifting all day, every day, or excessively, or you suffer from bronchitis or asthma and you've done a lot of coughing over the years, different things like that can strain the pelvic floor as well. So it's not only in childbirth. So.
And also people that do a lot of heavy physical activity in terms of like fitness, weightlifting, or even women that run, right?
Right, even some of our athletes, and because they're functioning at a higher level of activity, they need their pelvic floors to also function at that higher level, and sometimes it just doesn't match up, and so we can help kind of get that matched up for them.
Okay. So that's the kind of symptoms that they could be watching for. So ladies, or gentlemen, if you're struggling with these kind of issues, then you would be a candidate for physical therapy.
Correct.
For women's health. So that's what we want to talk a little bit about, give you an idea of what does that even mean and what does it entail. So
yeah, so when we have a patient that comes in, depending on what they're here for, usually if there's a pelvic floor condition going on that we suspect, we're looking at sort of their whole body first, their posture, their back, their hips, and their pelvis, and things like that from an external standpoint. But sometimes we also will do an internal pelvic exam to examine that pelvic floor that we were talking about, those muscles, ligaments, and nerves that are situated just a little bit interiorly. So we do that through the vaginal canal, and you can assess it fairly easily there to kind of find out what's going on with those structures.
Okay. So a lot of women, when they have, a lot of us, we know we got some issues down there, right? We're leaking urine, we've got some discomfort going on. So like the immediate thing we read about in magazines are the Kegel exercises.
Correct. So Kegels is a component typically of what we do with if you have incontinence or if you have prolapse symptoms, but sometimes with pain, Kegels can be the wrong way to go.
Yes.
So we prefer to have you come in and we'll take a look and help you determine which route is the best for you to go. Some people need a little bit of both, and some people have pain and they have leakage, and so it's like, well, where do I go with that? And we can help with that. And the other mistake out there, they've actually done some research on this, and most people that read about Kegels or are told to do them actually do them incorrectly. So that's a key component. When we can do the exam, we can make sure you're doing them correctly, which is key to getting it better.
Yeah, I agree. It is really important. So I know that I've heard stories. I talk to a lot of women, and you read stories. A lot of women think Kegels don't work, and then part of it's because we're not doing them correctly.
Right.
Sometimes it's that the muscles are too tight, right? So Kegels are actually exacerbating the problem.
Correct.
Right? So coming in here and working with a physical therapist, they do, like she said, they do, just to prepare you ladies, it's yet another physical internal exam. So, we already get to do those with our OBs every year. So this is a chance to come in and work with these guys. But they actually are trained in this. They know how to help ease. If you're having, one of the things that's big for women after childbirth is when they're, and maybe have some scar tissue, maybe having pain during sex and things like that. Again, you don't have to just let that maybe hopefully get better sometime. You can come in and actually get some internal physical therapy to help ease those issues, right?
Right. And our exam, we understand that somebody might be here for pain. And so we're doing the exam in a way that we're trying to help reduce the pain. And so as we're doing it, we're giving the cues and the different techniques that help bring that pain level down so that it's not painful. And we're not taking a sample of their cervix and things like that. So it's not really like getting a pap smear.
No.
It's definitely a little bit less, I guess it's not quite as deep as they go with the pap smear. So
yeah. And there's no stirrups, just so
no
you
stirrups.
know, no stirrups,
No speculum.
no, nothing like that. So that's bonus, right? Score. Okay, so we've covered. I want to talk about what kind of things damage the pelvic floor, and what sort of things strengthen the pelvic floor. Obviously, physical therapy will help with recovery, but what sorts of things are women doing that might be contributing to pelvic floor issues? Not intentionally, but just as a factor of life.
Right. Like we talked about, pregnancy and childbirth is definitely a big risk factor. The repetitive coughing is a risk factor. So people who have respiratory issues through their life, heavy lifting or improper lifting over time, especially. Sometimes if you're, having baby number 3 and you're carrying around toddler 2 and the other baby, you're putting a lot of extra strain if you didn't strengthen up between the pregnancies, things like that, are straining the pelvic floor.
Okay.
Constipation strains the pelvic floor as well, because every time you bear down to go to the bathroom, you're putting that extra pressure on the pelvic floor there as well.
Okay.
Posture can be an issue too. So if you kind of slouch, that increases your intra-abdominal pressure, and that places an added pressure on the pelvic floor.
Yeah, and I've done a lot of research into this myself, and footwear can actually be a factor. There's a website, it's www.katiesays.com, and she's a biomechanics expert, and she goes a lot into how women's footwear particularly can cause pelvic floor weakness and lead to pelvic floor issues later on in life. So if you're wanting to check that stuff out, I definitely recommend it. It's on my website under the Women's Health Resources, so look into that if you want to. So I think we've covered a lot of my questions. One point I want to make is, Molly, we talked about this earlier. It doesn't matter how long you've had these issues. So we women, like we said, we tend to suffer in silence a lot of the time. So if I know people that have had incontinence issues for a long time. So can physical therapy still help people that have been struggling with these health issues for a while?
Yeah, absolutely. That's the beauty of what we do here, I think, is working with muscles. You can really forever change your muscles and improve them. And so it doesn't matter at what point you come in. We almost always can help. So it's great.
Awesome.
That's what I love about my job.
That's right. Well, I mean, the fact that you're really making a difference and improving the quality of life in women's lives, I just think it's amazing. So, like I said, I've had physical therapy 3 times, once after childbirth. I've struggled with incontinence 3 times after childbirth, after surgery, and then last year due to some prolapse issues. And physical therapy has helped me every time to where I don't have any incontinence issues at all. So it's definitely worth coming. It's not something you just have to do once. We women, our vaginas go through health issues all through our lives. So sometimes we have to come back again and get refreshers and get help for the current situation. So don't be afraid to do that. So Molly, my last question for you is, are there any groups of people that really aren't good candidates for physical therapy?
Yeah, we really work with a wide range of people, and I don't really have any restrictions necessarily of people who couldn't come. Yeah.
Okay. So even children, elderly, wherever they're at, you
Correct.
can make it work.
Mm-hmm.
Awesome. All right. Well, Molly, thanks so much for your time and your expertise.
Sure.
She is here, guys. This is what we're about at Grow Your Green Family, is exploring what are the amazing resources we have available to us. Molly is definitely one of those.
Thank you.
We appreciate all her efforts in helping us out, and we'll see you next time on Grow Your Green Family. Thanks so much.